Mr. and Mrs. Jones were evaluating the various options that they had, and while they were at it, Mrs. Jones unfortunately had a fall and had to get admitted in a hospital for a hip replacement surgery. The surgery was successful and she's getting ready for discharge. The social worker in the hospital reaches out to the admissions coordinator of various nursing homes in the area. The hospital would make Mrs. Jones's discharge paperwork, or otherwise known as referral, available to these facilities. The document is sent to the facilities usually via e-fax, email, or manual fax. This referral document usually contains data which includes clinical condition, diagnosis and lab results, treatments performed, clinical needs, medication needs, any other special needs of the patients. The skilled nursing homes usually have a small window of time to respond to these discharge paperwork and must indicate their willingness to accept these patients via a return fax or email. The facilities also conduct a quick eligibility verification of Mrs. Jones with respect to her insurance, Medicare, Medicaid, or others. In case Mr. and Mrs. Jones were part of a life planning community, they could have moved into the skilled nursing facility within the life planning community itself. Once the facilities agree to take the resident in, and the family is also comfortable with respect to the ratings of the facility and other criteria that they might have, Mrs. Jones will be transferred via non-emergency transport from the hospital to the skilled nursing home. Facilities in the meantime prepare a room, sanitize it, clean it, ensure that the nurse call light is working, prepare the drawers. At the time of admission or just before, Mrs. Jones's details are entered into the EHR system. This process is called creating a face sheet. The most important information that would have to be entered would include first and last name, date of birth, gender, medical record number, details about the attending physician. Advanced directives could include information such as code status, which would indicate if it is a full code or if the instructions are not to resuscitate. This process can also be performed using the Continuity of Care document, otherwise known as CCD, which is a summary of Mrs. Jones's clinical information in an electric form. Hospitals that use Meaningful Use certified software providers can do electronic discharge and provide the CCD document. MatrixCare has the capability to export the CCD and can get the details needed for creating the face sheet directly from the CCD document. CCD usually contains the following information: insurance providers, social history, medications, care plans, immunizations, procedures, allergies, adverse reactions, alerts. Among others, CCD is a bi-directional document that can be sent to the hospital to from the skilled nursing home in the event that Mrs. Jones is getting readmitted to the hospital. Details with respect to demographics, diagnosis, allergies, and medications can be directly exported into the face sheet from the CCD document. Additional inputs would be required to complete the face sheet, such as consent forms, history information, payer information, among others. Once the face sheet for Mrs. Jones is created, an attending physician is assigned to her, and a census event is created. Once Mrs. Jones is comfortably situated, a nurse would begin a comprehensive admission assessment. This is also known as a head-to-toe assessment. This would help the nurse in capturing the vitals of Mrs. Jones and other information in the following categories: resident history, mental neuro, eyes, ears, nose, and throat, respiratory, cardiovascular, gastrointestinal, musculoskeletal, skin, pain. MatrixCare provides about 115 different predefined assessments such as pain assessment, skin assessment, psychological well-being, and many more. A facility can choose to create its own assessment too. Problems discovered from assessment will be documented, and a subsequent care plan with specific goal and approach would have to be documented. Initial care plan must be documented within 48 hours from the time of admission, and comprehensive care plan would be required within 7 days of the admission. In the subsequent videos, we will follow Mrs. Jones and her care providers as she gets better and look at medications, care plans, nursing general orders, events, activity orders, and many more.